My name is Dr. Georgia Lane. I am a large animal surgeon with a special interest in soft tissue surgery. What really drew my interest in ischemic lesions of gastrointestinal diseases in horses was when I was a student and I saw that a lot of the horses that had ischemic gastrointestinal lesions ended up doing very poorly postoperatively. I would say the number one most common complication that we see postoperatively in our colic patients is postoperative reflux or ileus, which is stagnation of the gut when the intestine stops moving. It is one of those that can really decrease a patient's prognosis. I hope that my research will help with intraoperative determination of viability. It's still really difficult, not only in our world in the veterinary community, but also within human medicine and surgery, how difficult it is for them to figure out where truly alive intestine sits and where the dead stuff truly starts. So it's my hope that my research will help surgeons in the operating room as well as postoperatively understanding postoperative complications and improve survival for the horse. Referring veterinarians can support our research by sending us colics as well as participating in sending us samples, both blood and peritoneal fluid. Even sending those with the horse can be really helpful in determining and accepting biomarkers and intestinal viability studies.
I'm Dr. Callie Hobbs, and I here at Texas A&M University am both a large animal internal medicine specialist as well as a food animal internal medicine specialist. So what my group primarily works on is something called hemoperfusion. To put it really simple, it's a bit like a Brita filter for your blood. Horses that have hepatic encephalopathy and different liver diseases actually tend to benefit really well from it. Horses that have ingested toxins such as rodenticide or have like a severe snake envenomation. And then the other thing is horses that are in the throes of severe sepsis that are not responding to traditional care certainly can really benefit from having hemoperfusion as part of their care. I tell everybody it's a great adjunctive therapy. It's certainly not a fix-all, it's not a magic bullet, but it is one thing that we at Texas A&M can do that's a little bit kind of a step above, and that's a unique option. So whenever I think back to the most memorable cases, it was actually the first horse that I hemoperfused at Texas A&M. This was a horse that came in for severe liver disease. We were able to do hemoperfusion on her, and she actually within a couple of days completely turned around. She's come back to visit us since. She looks absolutely great. And so for her, it kind of made me see that it really can work. So if you're thinking about sending a horse for hemoperfusion, for us, there's a couple criteria. One of them is like, does the horse have a condition that hemoperfusion would benefit, such as sepsis, toxin ingestion? The other thing is the patient stable enough to be able to have catheters placed and to go through the hemoperfusion process? And the biggest kind of take home though is if you have a candidate, a horse that you think hemoperfusion may help, to call early, just because the earlier in the game we can intervene, the higher our success rate is.